Go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead, 5 minutes.
Thank you, Mr. Chair, and thank you, Minister Hajdu and health officials for joining us today. It's always great to hear from you on what we're doing to protect the health of Canadians, especially while we continue to fight this virus. Minister, I want to ask you about our vaccine rollout, since you were so rudely interrupted when you tried to respond earlier. Vaccines are top of mind now for most Canadians, and our government has been instrumental in delivering vaccines to provinces and territory. Now we're seeing over 1 million doses arrive every week. Can you tell us more about the work the federal government has done to get vaccines to the provinces and to the territories?
Well, thank you very much to the member for this question. And I just do want to give a huge congratulations to everyone at the Public Health Agency of Canada, and in particular Major General Danny Fortin, who's been instrumental in the vaccine rollout with provinces and territories. It's been efficient and organized, and I know he's working really hard. Perhaps I could give him a couple minutes to speak about his work with the PTs.
Mr. Chair, thank you very much. And it very much is a team effort. And we work closely with provinces and territories, as well as with other federal departments, to ensure the most efficient rollout as possible. By the end of the day today, we'll have nearly 4 million doses distributed across the country. And provinces and territories are working on scaling up. And we've ensured that we provide them as much predictability as possible in terms of doses arriving and when, with forecasting projections as well, or forecasting tools to help them visualize what they will receive and when in the different types of scenarios. And we'll continue to ensure that we respond to any requests they would have, none at this time, but any requests they would have in terms of repositioning or buying additional cold chain enabling equipment. And I should say that we also share a lot of best practices amongst provinces. We've shared administration model playbooks just a week ago, and they're very much looking at different modalities to distribute their vaccines.
Thank you. Minister, given the limited supply in the entire world to get vaccines, are the recommendations by NACI and Health Canada unsafe?
Well, thank you, and through the chair and to the member, that is a question that's best placed to Dr. Tam. These are scientific recommendations made by experts for the use of provinces and territories. And, our government, as you know, has been guided by science and evidence in our response. So perhaps I can turn to Dr. Tam.
If I could add, are we putting Canadians at risk with these recommendations?
Dr. Tam?
From a regulatory perspective, Health Canada takes extreme seriousness and high standards in reviewing the data in front of them, which a lot of it is the clinical trials, tens of thousands of persons studied, that they are safe and effective, of high quality, and that the benefits far outweighs any risk. That is the bottom line. The National Advisory Committee on Immunization also takes into account the data, but also, in addition, provides a lens on looking at all the vaccines together, as well as the epidemiology of where Canada is at, who's at the highest risk in terms of risk factors, and feasibility, acceptability, ethics, and equity as they make their recommendations. The bottom line, though, is that any recommendation they may, of course, takes into account vaccine effectiveness and safety. So that is how they provide recommendations. And I think, as you've seen, the provinces and territories, through their chief medical officers and their vaccine programs, are essentially aligned with the NACI recommendations as well. So I think Canadians should feel confident that the vaccines provided are effective and safe.
Thank you. Over the past few weeks, we've heard from various witnesses and experts about these COVID-19 vaccines and recommendations. We've heard a lot of scientific terminology, some of which we are familiar with, some of which we are not, such as the public health officials, such as the ones that the public health officials use to talk to each other. Minister, I'm wondering if you or anyone of your health officials are able to clarify the difference between efficacy and effectiveness, clinical trial results and real world results. And if we have time, the different roles of PHAC and NACI and what they and the role that they play in immunization. I'm actually seeking for the type of definitions that people would understand at the grassroots level.
Well, thank you. It's a great question, and I think again I will turn to Dr. Tam. There are some aspects of your question that are more easily explained than others, but I will agree that there are a lot of terms flying around, and we want Canadians to have as clear of information as possible, and that's why we're grateful to Dr. Tam for her daily or very frequent pressers to Canadians, letting them know all things COVID. Dr. Tam?
Well, I'm very happy that people in Canada have significantly elevated their knowledge base and scientific acquisition of that knowledge. And so vaccine efficacy is generally used to describe the data coming out of clinical trials that are done in very specific circumstances under a great deal of protocols. And they're generally done, as you've seen in phase 1, 2, and 3 trials, escalating to phase 3 with tens of thousands of patients enrolled, where they compare those who are vaccinated and those who have received a placebo or another vaccine to see what the final outcome is. And that's how you get the really high effective rates, highly efficacious vaccines, or the results coming out of those trials. And and the safety also is monitored through the clinical trials. Then after authorization by regulatory authorities around the world, the vaccines are then deployed in the millions and tens of millions as it stands all around the world. And the real life on the ground performance of the vaccine is called vaccine effectiveness. And in general, one might expect it to be a bit lower than what you find in well-controlled environments. And so those are the real life in field, you got to give the vaccine under different circumstances, different populations, some in the remote areas with different logistics. And what is really very heartening is that the real life on the ground data is really good as well as it stands. And some of them are coming out of British Columbia, Quebec, Ontario, demonstrating in real life the vaccine effectiveness, particularly right now in reducing long-term care facility impacts in a very significant way. So that's effectiveness. And safety is also.
Excuse me, Dr. Tam. I'm sorry, I have to cut you off there. Thank you.
Thank you, Mr. Chair.